Hello, I'm a physical therapist with Iredell Health System. Today, I'll be going over what to expect following your total hip replacement surgery and how physical therapy will assist your recovery. You will receive physical therapy on a daily basis after you have your total hip replacement surgery. Depending on your surgeon's preference, you may receive physical therapy on the same day of your surgery or the morning after your surgery. From that point forward, you will typically do physical therapy twice a day, once during the morning and once during the afternoon. In addition to physical therapy, you may be evaluated by an occupational therapist to assess any limitations that may arise with self-care, such as bathing or dressing. Our goal is to get you moving as much and as soon as we can so that you can return home as soon as possible. During physical therapy, you will be guided through exercises for your hip. You will be assisted with getting out of bed, walking, and stair training in order to prepare you for a safe discharge home. The exercises are pictured in your Total Joint Replacement Handbook under the Rehab section. While in the hospital, you will be assisted by hospital staff members anytime that you get up in order to prevent any possibility of falling. After your hip replacement surgery, you will have some movement restrictions for a time period determined by your surgeon. These restrictions are hip precautions, based on where your incision is made. The hip precautions are to prevent your surgical hip from dislocating or coming out of place. There are two types of hip precautions: posterior hip precautions and anterior hip precautions. With posterior hip precautions, you should not cross your legs, turn your toes inward, or bend your surgical hip more than 90 degrees. With anterior hip precautions, you should avoid turning your surgical toes outward and making wide steps backwards or to the side with the leg you had surgery on. While you are in the hospital, you will learn and practice following these hip precautions. In addition to physical therapy, an occupational therapist will assist you in modifying your activity based on your hip precautions. Hip precautions are also listed in your Total Joint Replacement binder for your reference. Following your hip replacement, you will experience pain. The pain should improve over time and as you progress with physical therapy. Pain management is an important aspect of your surgery, and you should utilize pain medicine as prescribed, including ice packs, to help control your pain. The goal of managing your pain is to keep it at a tolerable level so that it does not prevent you from progressing in your recovery. Again, while you are in the hospital, you will work with physical therapy twice a day, working on your exercises, walking, and climbing stairs. Our goal is to make sure you are safe to go home. Once you discharge from the hospital, you will likely continue your therapy at home with a home health agency. They will assist you with continuing to progress towards your personal goals. These physical therapy services are also available in an outpatient setting for patients that are not homebound. The length of time required for this type of care varies with each patient. We look forward to helping you with your recovery.